Hi, my name is Emil Chin, and I'm the owner and lead surgeon of Park Avenue Laser Vision. What makes us special? Well, at Park Avenue, we have the longest track record and have done the most non-cutting procedures of any center in the United States. We actually specialize in non-cutting. So if you can't get LASIK, you can get LASEK. And I'm probably the #1 surgeon objectively in LASEK. The difference between PRK and LASEK is how cleanly you remove the epithelium. If you remove the skin of your eye in many different pieces, you're essentially killing and crushing millions of epithelial cells, which release signals to the eye that it's been damaged. That causes the pain, inflammation, and scarring that sometimes happens after PRK. So you will hear PRK surgeons say, I can't go past -6 because then I might have the patient scar. With LASEK, because we're taking off the skin of your eye in one clean sheet, not only is it totally painless to you, but we can treat much higher prescriptions without the fear of scarring. Now, we also use special medicines like MMC that the average LASIK surgeon is not familiar or comfortable with. We're using MMC every day of the week. We're actually using more MMC than New York Eye and Ear, which is 300 doctors. The reason we know this is we used to order the MMC from New York Eye and Ear, and eventually they called us and said, we can't provide it to you anymore. And we said, why not? And they said, well, you're using up the entire supply of the hospital. So now we get it directly from the manufacturer. This is just to show you that our 5 doctors have more experience with surface ablation and MMC than 300 doctors at New York Eye and Ear. SafeSight is not just the LASIK technique that I do, but it's the entire pre-op and post-op process, particularly the post-op. In other words, if you go to a surgeon who mostly does LASIK and you say I have a thin cornea, yeah, sure, he can do a surface ablation, but it's going to be like a PRK even if he calls it LASEK. In other words, my patients recover in 1 weekend, they have absolutely no pain, and they have no chance of scarring, and that's because of 15 years of continuous refinement. Sometimes we have patients who come to us for second opinions and they got supposed LASEK somewhere else. Now, oftentimes the results are good, but then they go away. Why is that? Because the post-op regime of all the different drops is totally different for LASEK versus LASIK. And if you get LASEK at a LASIK center, they're probably going to give you kind of like the same drops they give the LASIK patients, and the results won't be as good.